Recognizes the gentleman from Maryland, Mr. Cummings, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I rise today to recognize National Children's Dental Health Month. And it's a critical part of the overall health, yet it's also an issue frequently overlooked. Too often we think of dental care as an optional service, when in reality it is a critical component of overall health. Its importance first hit home for me 7 years ago when I learned the story of a young Maryland boy named Diamante Driver. In February of 2007, 12-year-old Diamante came home from school with a headache, which had started as a toothache days before. His mother, who worked hard to make ends meet with low-paying jobs, searched for a dentist who would accept Medicaid for her children. She found not one dentist. Let me say that again. She found not one single dentist who would care for her children's teeth. At wit's end, Diamante's mother brought him to the emergency room, where he received medication for pain, a sinus infection, and a dental abscess. Unfortunately, that was not enough. The bacteria from Diamante's cavity spread to his brain, and at 12 years old, he died for lack of a simple procedure early on to remove a tooth. He died less than 20 minutes away from where we stand today. Diamante's case served as a jarring lesson on the lack of access to care for many families. At the time of Diamante's death, fewer than 1 in 3 children the age of 20 in Maryland's Medicaid program received any dental service at all. But in the years since, with the passage of the Affordable Care Act and new efforts to ensure a healthy America, we made significant progress in Maryland and across the country. In other words, we have changed the trajectory of so many children's destinies. 52% of children on Medicaid in Maryland now receive dental services, even as the number of children enrolled has increased by 25%. In fact, through the work of government officials in Maryland's Dental Action Coalition, the state has led the way in increasing access to dental care for children. Nationally, the number of children enrolled in Medicaid who received dental care in 2010 jumped to 46%, numbers that suggest progress, but also signal the work left to be accomplished. The implementation of the Affordable Care Act has made a difference, allowing millions more children to receive critical medical and dental care right now. Even more children could access these services as Republican governors in some states reversed their decisions to block the expansion of Medicaid. I've often said that our children are the living messages we send to a future we will never see. Yet, even with the improvements we've seen, more must be done to ensure that both children and adults have access to needed treatment and preventive care. That's why I introduced the Comprehensive Dental Reform Act. My legislation would provide funding to improve access to dental care through health clinics, school-based services, and other options for underserved populations, extend comprehensive dental coverage to Americans on Medicare, Medicaid, VA benefits, increase the number of oral health professionals in communities in need, and help support research and education to better integrate oral health with regular care. We've come a long way, but more must be done to protect the dental health of our children and every American. If we can assure no child loses his or her life because a dentist couldn't be found to pull a tooth, Diamante's death won't be in vain. And with that, Mr. Speaker, I yield back.